Hi, this is Dr. Farley. We're going to be going over your Array 3. This Array 3, we're measuring antibodies against wheat, gluten, different subtypes of gluten, and also a small autoimmune reaction on these products called transglutaminase. The purpose of this is because most people out in society are having major issues with gluten. But there's three names that you're going to hear out there. Oh, is this an allergy? No. An allergy is an IgE antibody response to a food or an environmental issue or a dog, a cat. We're not talking about that. Oh, is this celiac? No. 1% of the population has a true celiac. But over 90% of the population has an issue with non-celiac gluten sensitivity. And if your test is positive on here, that's what you have. Non-celiac gluten sensitivity. Not allergy, not celiac. So when we talk about celiac, it's really like, who cares? It's only 1%. But 90% of people are having an issue with this. So you may have gotten tested by a medical doc, an integrative doc, and they said, oh, you don't have celiac. So you think that gluten's not an issue for you. The real deal is you probably have a gluten issue. You have a 90% chance of it because that's what it is in society. And the testing they did is nowhere near deep enough or thorough enough for you to understand what's going on with this problem here. So when we get your results back, we're going to look at a bunch of different proteins. That's what we're measuring here, proteins. And we look at the whole gluten protein, and then as the gluten protein breaks down, it becomes different names. We look at all those as well, because you may not test positive for the whole gluten protein or the typical protein that they test for celiac, but you test positive for 5 of the subproteins. Either way, it's a gluten problem. You have to remove it. So we'll talk about that. We also want to let you know that in here we tested for certain enzymes, transglutaminase 2, 3, and 6. These enzymes are majorly involved with a lot of different things going on inside your body and your brain. And if you tested positive with these enzymes, what you want to know is these transglutaminases, they can create major autoimmune diseases over time. So transglutaminase 2 can increase your risk of celiac disease, Crohn's disease, dermatitis, herpetiformis, and ulcerative colitis. So if this is positive, all those diseases go very high up because you're creating damage. Let me explain also autoimmune. There's 3 stages to autoimmune. First stage, I have an antibody against, in this case, an enzyme that's inside your body, and basically I'm destroying those tissues over a time frame. Second stage is the stage 2 reactive stage. These are where a lot of people are getting a lot of very diverse, weird symptoms. They can be neuropsychiatric symptoms like depression, anxiety, bipolar, schizophrenia, Lou Gehrig's disease, dementia, Alzheimer's, Parkinson's. All of this stuff can be connected to a potential neuroautoimmune or autoimmune process taking place. And then also what will happen is when you get these autoimmune, then you may move into full stage 3, full blown. Now, normally I'm going to tell you this. The reason why there's a problem with this in the U.S. is because if you drop into one of these boxes, a typical medical doc will look for lupus, scleroderma, multiple sclerosis, Sjogren's disease, what else is there? Ulcerative colitis, psoriasis. These are typical autoimmune diseases, but trust me, there's between 80 and 100 autoimmune diseases. So number one, the medical docs don't even give you that diagnosis unless you come into one of these simple little boxes. And if your symptoms don't look exactly like blah, 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 they tell you don't have it. But if you do have it, what are you going to do if you get one of these names? Well, guess what they use? They use 2 things. We're going to give you high doses of steroids, and steroids will debilitate you and kill you over a long time frame. And number 2, we use chemotherapy type drugs. That's what you get if you end up in stage 3. So we want to know early on, do you have these predictive antibodies that show up 10 to 15 years and can give you a potential up to 80 to 100 autoimmune diseases? Are you in stage 2 where you're showing signs of reactivity, and most of you are there because you're coming to me with multiple different problems? And even some of you are in stage 3 where you have that issue going on. So transglutaminase 2, these are enzymes located all throughout you. And basically these enzymes are loaded in a lot of different areas, but the main areas where they're found is in the gastrointestinal system, and they also can be in major issues with your esophagus. And it also will increase your risk of celiac disease. Transglutaminase 3. This also will increase your risk of celiac disease, dermatitis herpetiformis, esophageal cancer, because they're majorly located here. And if you keep attacking that with an autoimmune reaction, you can increase your risk of esophageal cancer. Gluten sensitivity and Huntington's disease, which is a movement disorder that people get because the brain breaks down from your immune system attacking transglutaminase 3. Now, why would your body attack these enzymes? Because there's an underlying gluten issue. And pretty soon, your immune system says, oh, here's gluten. Oh, and here's this enzyme. It looks similar, and it just attacks it. The problem also that you want to know is if you come down with this autoimmune issue and you have this taking place inside of you, it's very dangerous on a long-term basis. And you need to understand what's going on and what you can do to prevent this. Transglutaminase 6. This increases your risk of celiac disease, cerebral palsy, it could be in you or your child, gluten ataxia. This is a major issue for back pain, neck pain, sports injuries, balance, walking, coordination issues. And then the whole brain breaks down because you're destroying the cerebellum. Gluten ataxia with enteropathy, which means major gastrointestinal issues, gluten reactivity, idiopathic sporadic ataxia, again, balance and walking issues, and then lastly, peripheral neuropathy. This is majorly involved also in brain, spinal cord, and nerves, as well as transglutaminase 3. So these also can show up as neuropsychiatric issues, again, like depression, anxiety, bipolar, schizophrenia, dementia, Alzheimer's, Parkinson's, Lou Gehrig's disease. All of these can happen when we're attacking transglutaminase 6. So that's the summary of your array 3. I hope you found it informative.